today, we're seeing that the conditions to keep our initial reopening calendar in Montreal are not met for the moment. That's why we've decided to delay the reopening of businesses, daycare centers, and schools until May the 25th. And as I've said in the last days or weeks, this will happen only if the conditions are met before May the 25th. Our biggest challenge right now remains the lack of staff in our health system. That's why we've decided to give a bonus to healthcare workers that work full-time in public CHSLD, in senior homes, and in hot zones of Montreal's hospitals. This means as much as $1,000 more per month for full-time workers that are active for at least 1 month. Our chair of the Treasury Board will explain the details later. So if we want to return to a more normal life, we must stay very disciplined. You can count on me. I'm counting on you all. Thank you.
Good day. I sometimes think I'm asking the same question about Montreal every day of you, Mr. Arruda, but with your announcement today of delaying openings, can you bring us up to date about what is the virus doing outside of the CHSLDs in the community? You are not below 1 yet on the RO index. Is it there's still many people being diagnosed? Can you specify which part of Montreal is more vulnerable and what is being done to stop the virus?
First of all, it's clear that we are going to have, as we are augmenting the testing, the cases are going to be up. It doesn't mean that the thing is getting worse. It means that we are perhaps measuring better the situation because there is a lot of asymptomatics and cases that are probably not getting to diagnosis. We will look at everything that we open if we're going to have some outbreaks. Actually, we have not observed big outbreaks, I would say, in kindergartens. In fact, there have been some cases, but there has not been an explosion of cases on those places. There is some, I would say, specific outbreaks that are going on. You know, there was one in Côte-Saint-Luc before related to trips to New York. There is Saint-Michel up north. There is people there who worked probably in the hospitals or imported that from the CHSLDs or imported. And we are now screening a lot in these communities to have a better idea of what is going on. And every case will be checked by public health. We're going to have an inquiry, find out specific contacts, offer them tests, and take the situation into account. So the situation in Montreal and Laval is very, I would say, intensive. Around in the suburbs, there is also some issues, but not as active in certain hotspots in Montreal. And if you go see on the website of Montreal, we will have these hotspots in their website.